Nursing students from around the world are set to benefit from a definitive new textbook launched in April, Mental Health, a person-centred approach.
Mental health nursing education is really having arrived and being picked up and taken notice of by the world's oldest publishing house. So at that level, I think it means that we have arrived at a level that we had never previously been engaged at.
The book was written and edited by UniSA's Professor Nicholas Proctor, Chair in Mental Health Nursing. It also includes major contributions from colleagues Dr. Helen Hamer, Denise McGarry, Rhonda Wilson and Dr. Terry Froggatt.
So each chapter had up to 5 reviewers, which I think is an outstanding level of scrutiny for a publication of this kind.
Well, Nicholas Proctor asked me if I'd write the foreword from a carer's viewpoint, and I was very nervous about the whole idea, but when he said that it was people-centred and that it was going to be about stories of people, I felt as though I'd really like to give it a try.
The textbook has been written to teach nursing students a person-centred approach to dealing with patients with mental health conditions.
Person-centredness is about personhood, being privileged above anything else. So in other words, when people tell their story, they tell the story of who they are and what they stand for, but they also tell the backstory of how things got to this.
The authors of each chapter have introduced consumer carers or mental health consumers to provide their very personal stories of their experience in dealing with mental health illness.
I do have a story to tell, and it's the story of my son Nicholas. And Nicholas died when he was 26 years old, and after he'd gone, all that remained was the memory of his love and his story. And I knew that he'd enjoyed being a student himself and that he wouldn't mind me sharing his story with other students. And I felt if I could do it honestly, it might be something that they might be able to relate to when they read it. And it might become almost a conversation that he might have had with them if things had have been different.
It is the first time in its history that the world's oldest university publishing house, Cambridge University Press, has published a textbook in this field.
We have published in the area of psychiatry, but never for mental health for nurses. We felt that it complemented our growing list in the area of nursing on a global scale because of our experience in medical publishing, but also locally we are rapidly building a list in nursing textbooks. Mental health was an obvious choice for us. It's a very important subject within a nursing degree program.
This is the first one that they've done in mental health nursing ever, and when you consider they're 500 years old, it's pretty important. They have a whole section that deals with mental health, but nothing on mental health nursing. So for UniSA to be the first trailblazer in this space, in something that's so relevant to so many people, I think it's a pretty big achievement for the university.